Welcome to our training session on communication and interpersonal skills. Training objectives. By the end of this training, you'll be able to understand effective communication, recognize the importance of verbal and nonverbal communication, identify barriers and resolve conflicts, enhance interpersonal skills for better relationships, use therapeutic communication with patients of all ages. What is communication? Communication is the process of sharing information, thoughts, feelings, and ideas. Sender, person delivering the message. Message, the content. Receiver, person interpreting the message. Why communicate? Communication helps in 1. Exchanging information, 2. Building relationships, 3. Expressing emotions, 4. Problem solving, 5. Making decisions. Communication methods. 1. Verbal, spoken words. 2. Nonverbal, body language, facial expressions, etc. 3. Written emails, reports. 4. Sign language, hand movements and gestures. 5. Electronic devices, communication tools for those with speech impairments. Verbal and nonverbal communication. Verbal, clear, concise, and respectful speech. Nonverbal, facial expressions, gestures, body language, and tone of voice that support verbal messages and help convey emotions and intentions. Written communication. Key elements: clarity, conciseness, tone, organization, grammar. Tailor your message to the audience and purpose. Proofread for accuracy. Use visuals to clarify complex information. Sign language. A structured form of communication using hand movements, gestures, and facial expressions. Widely used in the deaf community. American Sign Language, ASL, is the standard in the U.S. Basic signs can be learned to enhance communication. Common signs include thank you, help, bathroom, and love. Communication disorders. Speech, articulation, fluency, voice disorders. Language, understanding or expressing thoughts. Hearing, issues with sound processing. Cognitive, affects memory and social communication. Social, difficulty with social interactions, for example. Autism. Behavior as communication. Behavior often communicates needs or emotions, especially when speech is limited. Common behavioral cues: crying/screaming, frustration or pain. Smiling/laughing, happiness or enjoyment. Pulling away. Discomfort or refusal. Pointing, expressing a request or preference. Example: a person tugging on your sleeve may want attention. Effective interpersonal skills. 1. Active listening. 2. Empathy. 3. Adaptability. 4. Respect. These skills help build trust, resolve conflicts, and improve collaboration. Barriers and conflict resolution. Barriers: physical, emotional, cultural, and language. Overcome by clarifying messages, fostering open communication. Conflict resolution: separate issues from people, listen, brainstorm, and agree on a solution. Therapeutic communication. Purpose: helps patients understand their condition and cope. Key elements: active listening, open-ended questions, empathy. Avoid personal opinions, minimizing feelings, false reassurance, and accusatory why. Questions. Building trust. Ask and explore emotions. Use questions like, what concerns are on your mind? To understand the patient's feelings. State facts. Offer supportive statements like, your vital signs are stable. Combination approach. Acknowledge emotions and validate feelings, e.g., this must be overwhelming for you. Techniques: explore emotions, restate, and reflect for clarity. Age-specific communication strategies. Infants and toddlers, 0 to 5 years, use simple language, engage in play, and be patient. Validate emotions, provide choices, and lower yourself to their level. School age, 6 to 12 years, use logic, encourage questions, and be supportive. Adolescents, 12 to 18 years, respect privacy, offer clear explanations, and collaborate on care decisions. Elderly, speak slowly and clearly, use simple language, and show empathy. Final thoughts on communication. The power of communication and interpersonal skills. Communication builds relationships, fosters understanding, and helps us work together effectively. Strong interpersonal skills create an environment where everyone feels heard, respected, and valued. Therapeutic communication: listen actively, show empathy, and ask open-ended questions. Avoid non-therapeutic communication, skip personal opinions, false reassurance, and why questions. Build trust, explore emotions, and offer factual, supportive responses. Age-specific approaches: infants to elderly, use simple language, be patient, and adapt to their developmental needs. General tips: be clear, acknowledge emotions, and show compassion. Thank you for watching the Communication and Interpersonal Skills module. Please answer the questions for this training before moving on to the next training module.